Holy cow, folks, the FDA is set to remove a black box warning related to hormone replacement therapy for the treatment of menopause. And while I'm not an expert on this subject, one of my colleagues who is an obstetrician and acclaimed author is Dr. Tang, who's going to tell you a little bit more about this.
So most women's health experts are celebrating this as a win, removing a barrier that's been scaring many women and even doctors away from menopausal hormone therapy for over 20 years. This warning has been on all menopausal hormone therapy since 2003 as a result of the Women's Health Initiative. And they mention risks of cancers and clots and strokes, and understandably people get very scared when they see these warnings. A big problem is the warning was applied to all hormone therapy, even though they have very different risk profiles. So it's basically glomming all hormones into one bucket and saying that they all have all these risks when that is not true. For instance, vaginal estrogen doesn't have any of these risks, cancers, clots, strokes, etc. And even most breast cancer patients can safely use vaginal estrogen, which makes a huge difference in terms of quality of life and even preventing dangerous UTIs. And transdermal estradiol, like patches and gels, do not increase the risk of clots and strokes. The timing and age of onset of hormone therapy also makes a massive difference. So the Women's Health Initiative, which is actually referenced in the box warning, was reanalyzed in recent years, showing that obviously younger patients have lower risk. So in general, people who are under the age of 60, less than 10 years after menopause, the benefits significantly outweigh the risks. I'll also point out that medication for women is always subjected to much more fear-based scrutiny than those that affect only men. For instance, I'm writing my second book about hormones, and I start off with this observation that everyone has heard about the risks of HRT, the breast cancer, etc., but who can name a single risk of Viagra? Did you know that Viagra has been associated with an increased risk of melanoma in many studies? It can also cause blindness, but Viagra doesn't have a black box warning, and HRT did. Now, all medications have potential risks, and McCary made some statements about potential longevity benefits that may not be supported by strong evidence, but ACOG's statement, and I fully agree, is that this is an important step in removing unhelpful barriers and accurate barriers to care, which allow for personalized, accurate counseling and talking to patients about their particular risks and their health goals. So hopefully this will get conversations started. Please see your doctor and talk about all these options. So if you want to learn more about the science behind menopausal hormone therapy and all the alternatives, I talk about all these in my book, It's Not Hysteria.